Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you is a nice example of a rare occurrence and an important pitfall. This is a case of an extra-gonadal germ cell tumor occurring in the duodenum. So this is a case of a 24-year-old male patient who presented with vomiting and abdominal pain, and on radiological examination was found to have a duodenal mass. The mass was biopsied, and this is the low power magnification of the biopsy. As you can see here, we have a malignant looking tumor with large areas of necrosis. Now, on higher power magnification, these tumor cells have some clear cytoplasm, very hyperchromatic nuclei, large areas of necrosis and apoptosis. And further zooming into the tumor, again, abundant pale cytoplasm, clear cytoplasm, and vesicular nucleus with a prominent nucleolus seen in a variety of around the area in a large number of tumor cells. And the first thing that would come to mind is whether this is carcinoma or not. And actually the case was positive with pan-cytokeratin. And here is the pitfall. Now remember, he's a young adult male patient with a mass in the duodenum, somehow central in location in terms of the body, in relation to the body. And you have always to remember that germ cell tumors in particular occur in central midline structures in young adults. So I attempted to do SAL4, and the surprise was that the tumor cells were strongly diffusely positive with SAL4. So I carried on further testing and further stains, and the tumor cells were also positive with OCT3/4, and then they lighted up further with CD30 supporting, all going in the same direction. This is a germ cell tumor, probably based on the immunoprofile. We're talking about embryonal carcinoma. Now, alpha-fetoprotein was completely negative. Glypican-3 was positive in scattered cells, but remember, Glypican-3 is useful as a marker for yolk sac tumor in the context of an elevated alpha-fetoprotein in the serum, as well as positivity of alpha-fetoprotein immunohistochemistry alone. It can be seen in other types of tumors, of germ cell tumors, like, for example, in the case of embryonal carcinoma. Now, I wanted really to share with you the appearance of the tumor on MRI before, at the time of diagnosis, before receiving any treatment, and then the patient went on, based on the diagnosis, to receive chemotherapy, PIP-based regimen, and there was complete disappearance of the tumor. The tumor just melted away. There was no evidence of residual tumor once the treatment was completed. Actually, we reported this case and another similar case, these two cases, rare occurrences, as examples of extra-gonadal germ cell tumors, an important pitfall that carries significance in terms of the diagnosis, the management, and the outcome for the patient. So the final diagnosis in this very interesting case is extra-gonadal germ cell tumor. Remember that this is a rare occurrence, but it's important because of the difference in the management, the chemotherapy regimen that the patients receive, in terms of the absence for the need to do resection for the tumor in the form of Whipple procedure, as was planned for this patient. And the overall outcome is extremely important for germ cell tumors if appropriately managed. So the take-home message actually from this case is that in young adult male patients in midline structures, whether this is in the GI, in the retroperitoneum, always remember to rule out germ cell tumors by utilizing the appropriate immunohistochemistry. Remember that germ cell tumors can be positive for pan-cytokeratin. So if you have any doubt, please apply something like SAL4 or a PLAB immunostain. These are pan-germ cell markers that can help to reach the diagnosis. And remember always to correlate with the other ancillary techniques like radiology, like serum markers. Talk to the surgeon or the physician in order to ensure that this is not metastasis from somewhere else like the testis. I hope you find this tip useful in your daily practice. Thank you.